What is up, guys? Welcome back to my channel. I'm Lauren Drain, and today I'm going to go over some of the second trimester must-haves for pregnancy. Basically, I'm going to go over symptoms, expectations, surprises, must-haves, like as in, you know, supplements and things you need to get through your second trimester, and the diet I've been following, my weight update, and the 20-week ultrasound. Okay, so let's get started. Just so you guys know, if you follow me on Instagram and you've seen some of my stories where I put out the raw realness of pregnancy, where I've kind of shown the ups and downs, the mood swings, where I'm crying one second, or I'm complaining, or I'm feeling insecure about my body, or just going through those emotions and you're not quite sure how to take that, I'll just kind of explain to you. I really wanted to put it out, the raw and realness of pregnancy. I see a lot of women and they look gorgeous, they look beautiful, they look amazing, they're glowing. And I really do think women are beautiful when they're pregnant, when I see other women. But sometimes I just feel like they only put out the perfect side, you know, like you only get to see the beautiful pictures, the glamorous pictures, the perfect angles, the perfect body, the perfect everything, like in a perfect mood, super happy and glowing. And I don't think that it always comes across that there's a lot of struggles women are going through during pregnancy. You know, you're losing your typical body shape, you're losing a lot of times you're losing your energy, you're losing your fitness level, you're losing your ability to do certain workouts, to feel fit, to feel strong, to feel your best. And so I think it's really necessary that we show women for the raw and real thing that it is, and that we do have moods.
Hungry. I wanted a cute picture because I wanted to feel.
Babe, are you about to cry?
Just leave me alone.
Oh, babe, come over here. Oh.
No.
Okay, I'm sorry. I love
No,
you.
you're not.
You're hormonal. You're crying for
Why are you making fun of me?
I'm not. I love you.
I just wanted to look cute for a second.
You do look cute. Stop. Oh, crap, hormones.
And we do cry, and we do get sad, and we do feel, you know, insecure or confused or not normal, and or upset and irritable and frustrated and hangry. All these things are real things that we go through, and I think it's okay to recognize it and to put it out there. So if you guys have seen me do that, that's the reason I do it, to kind of have you guys relate a little bit better, and in case you're going through something like that, you're not feeling abnormal or crazy or weird, because it's definitely, I feel like, super common. That's the feedback that I'm getting from a lot of people. I did have like someone once tell me that I need to stop complaining because pregnancy is beautiful. The chance to be able to have your baby is beautiful, and I will agree that it is the most amazing miracle ever, and I never really thought it would be this amazing until now. You know, I always thought it was a beautiful thing. I always looked forward to it. Like the whole time me and Dave were trying to get pregnant for like a year and over a year, I was so looking forward to that, being able to like make a miracle, make a baby and grow a baby, and it's just amazing. So I want it to come across that I'm not complaining. I'm super thankful. I feel super blessed. I don't feel upset, but there just are days where you simply don't feel yourself, or you don't feel beautiful, you don't feel sexy, you don't feel energized, you don't feel anything other than grumpy and hangry. So I just want to let you guys know that I'm gonna put out both sides there just for the realness of it, but that I'm not complaining. I'm super thankful. I know there's a lot of women struggling out there that are trying to get pregnant and they haven't, or they have an infertility journey that's extremely painful. I didn't go through it all that long. It was a little over a year for me, but I did experience those emotions of anxiety and depression and feeling like lost and hopeless because I didn't think I could get pregnant. I didn't think that my body could make a baby. So I know what that feels like, so I don't want anyone to ever feel upset like I'm complaining, because I'm super happy and thankful. I have a healthy baby, a healthy pregnancy, and there's also pregnancies that are really, really high risk and really difficult to get through. And so I'm very, 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 very blessed and very thankful, and I want it to come through that's the case, and I'm not at all complaining. It's more just putting out the raw, real emotion that a lot of women feel during pregnancy, that they don't necessarily feel beautiful, they don't necessarily feel They need compliments, they need encouragement. And if any of you men are out there watching this, I don't know if you got through this video, this pregnancy vlog, or if you have any interest, but please support your women, please support your pregnant women. Tell them how beautiful they are, tell them how gorgeous, tell them how proud of them you are, tell them that they are building your baby and you feel so excited for that, and that you're so thankful, and that your women are so strong and so beautiful and so amazing, because we really need that, guys. You know, even if you think that we're pretty, we don't know it or feel it as much when we're pregnant, because our bodies are changing, our energy levels changing, our moods are so off. Like, these hormones are no joke. You can't even feel your most confident sometimes. Even though you're super thankful about the miracle growing inside and connected with your baby, you just feel off. You know, you don't feel your best. So do your best, men, women alike. Anyone who could support the pregnant person in their life, please shower them with compliments and encouragement and empowerment, because it is a beautiful, amazing thing that we give life. Every one of us came from a pregnant woman. Every one of us. Like, think about that. You know, there's no one of us that have come without some woman giving up her body, her time, her energy for a baby, for you. And it's a beautiful process. So please empower women as much as you can, and make them feel amazing, because it's truly an incredible process, even when not everything's going well. All right, so if you guys haven't already watched my previous videos where I talked about my first trimester, things I've been experiencing and things like that, I gained 16 pounds in my first trimester. If you haven't already seen that video, I discussed the fact that I could only tolerate eating carbs, so I'm not going to go into too much details there, but just know that I gained a little bit too much weight, and my doctor was concerned, so she pointed out to me at my 16-week checkup. So she's like, you need to slow down on your weight gain, you know, try and moderate your intake a little bit more, and try not to gain too much weight too fast. So from week 16 all the way through now on week 20, I have maintained my weight. So I have not gone up. In fact, I think I was up 16.5 pounds or almost 17 pounds, and now I'm back down to just the 16. So I'm just maintaining my weight properly, and I'm going to explain to you guys what I changed with my diet, things I decided to start following, and it has worked really well for me. And I also wanted to go over some things that you guys might need if you're going into your second trimester, if you're in your second trimester, things you might need that will get you through. As far as my workouts, I discussed that in another video as well, but basically I'm doing 3 to 5 times a week of cardio. It's either boxing, sprints on the treadmill, stairs at like a HIIT pace. So I'll do like kind of elevated pace to get my heart rate up to like the 130s. So somewhere between 25 and 45 minutes, so 3 to 5 times a week. So that's doing enough for me to maintain my weight, and it was able to drop the 2 pounds that I needed to just kind of stay there. My meals. I actually recorded on my MyFitnessPal what I've been eating kind of consistently, so I'm going to go over that with you guys. Alright, so I am following, every day I have a coffee in the morning with almond milk. I usually have a couple eggs, either one whole egg with several egg whites or a couple egg white bites. I also have turkey sausage, about 2 links, and sometimes I put American cheese like on my eggs. So that's breakfast. For meal 2, I've been having 4 ounces of chicken, 1 cup of mixed greens, a tablespoon of Parmesan cheese or some type of cheese, and slices of apples, like a quarter or eighth of an apple. And then my next snack is, I think, 1 to 2 tablespoons of some type of nut butter, or a couple ounces of nuts, a quarter cup of blackberries, and then I have another snack somewhere along where I have a full egg and a chicken sausage. And then the last meal of the day, I've been having either chicken or turkey sausage, or chicken or turkey meatballs with zucchini noodles or spaghetti squash. So what I've been doing previously was following a rather low carb diet. And so I'm trying to maintain somewhat of a low carb because my body responds really well to that. I feel super energized, and I don't feel as sluggish. I don't get like the afternoon crash and that kind of like sluggish feeling that you get with a low blood sugar. I like to keep it kind of stable. So I've been eating, most of my carbs are either in berries or in the veggies. And then I also, to that turkey meatball, zucchini noodle, I add like a quarter to a half a cup of non-fat cottage cheese, and then the tomato paste or tomato sauce. So that's a full day of eating for me. I'll also have like 2 pieces of like low-fat string cheese or something like that as a snack. So all in all, I'm eating about 1,700 calories, and I think I wrote down here my macros. I'm not following anything super strict, guys. Just this like fills me up. It makes me feel energized, and it's basically a high protein, moderate fat, lower carbs. So 85 grams of carbs, 96 grams of fats, and 183 grams of protein. So this is what I've been eating every day, and then I drink half a gallon to a gallon of water as much as I can. I live in Vegas, so it's very hot and dry here, and I have to remind myself to drink, especially with the coffee in the morning. So I'm drinking a lot of water. I also add Benefiber to my water to make sure I'm getting enough fiber, because I'm not eating a ton of greens. You know, I'm only really having the cooked noodles and the one salad a day. So I'm getting a little bit of greens, but not a ton of fiber. But yeah, I'm trying to drink as many of these, fill these up in a day I can, and I also add electrolytes to them too to make sure I'm not getting too dehydrated. I use Hydrate. This is by ID Life, but there's a lot of different electrolytes in the market you can use. So I just use a scoop of that and add it to my water. And if I don't have a coffee, I'll have one of these drinks. These are Celsius, like Live Fit. They're 0 sugar, 10 calories, super delicious, and I'll have one of these a day to help with my energy level. So that kind of gives you an idea on my intake a day, and it's been working really well for me to feel energized, full, satiated, and maintain my weight. All right, so I'm gonna go over supplements real quick. I have been following my prenatals, and in the very beginning I was super nauseous, so I couldn't have any pills. So I went ahead and did the Smarty Pants prenatal, which has multivitamins. Omega-3 is already in there, so you don't even have to worry about getting extra fish oils if you don't want. Vitamin D, vitamin B12, vitamin K. So there's a whole bunch of stuff in here. I take 6 of these a day. That's the recommended amount. It also has folate instead of folic acid. So if you don't know a lot of details about that, folate is often more recommended than just folic acid. Some people don't break down folic acid if they don't have the enzyme, which can actually be a struggle for you to actually get the nutrients. So I take folate, and they have that in here. Calcium is good for babies to build their bones. During the 2nd trimester, baby is building bones. So their cartilage is forming into bones, so it's really good to get your calcium in every day. So I take that, as well as the vitamin D to help with the bones and also immune system. I also take extra omega-3s. I'll either take a couple omega-3s. These are triple strength, or the MCT oil. I'm taking in a little bit less oil than I was with my keto diet, so I'm actually getting the supplements to help baby build brain and nervous system and the rest of the body health through the omega-3 intake. So I make sure to take that every day. And now there's a couple things just to get you through pregnancy. If you're having pains, which I've been suffering from, soreness and pains, the round ligament pain, the pelvis pain that I was telling you guys about after my workouts. So you can take Tylenol during pregnancy. It's definitely safe. So I take 1 to 2 tabs as needed. Also, so you can have Tylenol. Some women struggle sleeping. I definitely need Benadryl, 1 tab at night to help me sleep. It works perfectly fine. I get a good 8 hours and no issues. But I know towards the end it'll be more difficult to sleep with baby moving around and stuff. But right now, I'm not feeling her move yet. I'm sad about it.
Right next to the bed.
I know. I just want to see her again in the video.
Okay, how about I play back the video?
I can't feel her yet.
I really want to feel her move. I also take a prenatal, 2 tabs of a prenatal probiotic. This helps with heartburn, constipation, morning sickness. It promotes a healthy gut in mom and in baby. It actually helps prevent a lot of the it basically helps baby build a healthy gut, so there's not as much tendency to get food allergies and food intolerances and such. So I really highly recommend doing this. It's just going to really help baby be able to process foods better, to get a really good gut flora, really good healthy bacteria in baby. So also going to help with immune system. When you get sick, you really can't take a lot of things when you're pregnant, so you want to avoid getting sick at all costs. So you really want to make sure you're filling yourself up with healthy bacteria, good healthy gut bacteria. So take that. Also, I'm worried about stretch marks. A lot of you guys have been asking me what do I do to prevent stretch marks. I try to stay as hydrated as possible, obviously, take my vitamins and such, but I also use cocoa butter, Palmer's cocoa butter formula with vitamin E. It's a massage lotion. I don't know if you can see that very well. For stretch marks, it has collagen, elastin, argan oil, and shea butter. It helps reduce the appearance of stretch marks. So I use a couple pumps of this and I mix it with a rose hip oil. So if you could see this, 100% pure and natural. It's cold pressed. I just got it off of Amazon. It was highly recommended, had good reviews. And I just use a couple drops of this into the couple pumps of oil, and I rub it all over my belly. I rub it on the tatas, the belly, the sides, the back area, and on my thighs, because at the end of the day you can get stretch marks anywhere. Your skin is not moisturized, and I've been informed by you guys, a lot of you guys saw me itching and scratching myself and you advised me not to. I definitely want to make sure you're moisturized enough so that you don't scratch and itch, because you're creating micro tears in the skin, which could stretch and cause tears and lead to, you know, discolorations, stretch marks, etc. So don't scratch, don't itch, just moisturize as much as possible. Also, let's see, what else has been going on? 20-week update. So I also had my first Braxton Hicks experience, which was interesting. Basically, I just got done with a massage, and I probably wasn't drinking enough water that day, and I got home within a couple minutes. I was like 20 minutes after my massage. All of a sudden, my lower abdomen started tightening up, really, really painful, really tight, and I was like, it was sharp shooting pain. I'm like, what is going on? What is going on? I had to jump into like a warm bath and try to figure out what was happening. The tightness lasted a couple minutes, and it was painful and tight, and it was just like squeezing and cramp, and then it went away. And then I had one more, and I got out of the bath, dried off, and I laid down, and it went away after I like laid down. So definitely it was interesting to feel my first Braxton Hicks. Is scary but confusing and not quite painful, but just kind of very shocking, you know, something you don't expect to feel. So I had that experience. So I think it was probably related to me not drinking enough water that day. I do live in Vegas, and I hadn't had a full gallon by any means that day. So they say stay as hydrated as possible. So yeah, but it went away and I'm perfectly fine. Everything's healthy. So if you guys haven't been following all my stories and such on Instagram, I do post a lot of my real videos as life goes with this pregnancy, the things that I'm experiencing, the emotions I'm going through on there. So follow me at Lauren Drainfit on Instagram. But I've been very emotional about my daughter after I saw her face for the very first time on the 3D ultrasound right around 16, 17 weeks. I think it was 17 weeks. I saw her face, and it's so cute, and I felt so emotionally connected to her for the first time, and I just fell in love, and I was just so excited to see her, and I wanted to see her again, that I kind of like went on this saga of wanting to see her all the time. And there was this whole saga and chronicles on our Instagram about me wanting to get my own at-home sonogram and look at her face and see her and connect with her more.
Do you guys want to see crazy hormones? Lauren's right now crying because she misses our baby. She wants to see her face again. Oh, babe. And my mom's comforting her because I tried to comfort her.
And of course I went through that, and I got an at-home sonogram, but it was basically like a vet one you'd use for animals, and Dave's kind of like, we're not using this, and I was advised against it, so don't worry, I never did. I sent it back. But I really wanted to connect with her on that level and see her face and see her moving around and just really be emotionally connected. So I did end up getting a this is a fetal ultrasound. Well, I guess it's a fetal Doppler. It's called Angel Sounds, and it has little headphones attached. You can attach it to speakers or headphones, and then it has the ultrasound gel that you use with it. You just apply it right there, and you use it on the stomach. You can hear the heartbeat, you can hear whooshing, you can hear hiccups. Just you can hear what's going on in there. So you kind of get a little more connected with your baby. So this was really fun to get, because obviously you go a really long time between seeing your baby's face if you're waiting for your doctor's ultrasounds. It's every 4 to 6 weeks sometimes. It can be even longer if you don't need to be checking up on baby. Sometimes you only need a couple ultrasounds during your whole pregnancy, which I didn't realize. I thought they were way more frequent. So for me, this was awesome because I went to my 3D ultrasound, which I went to as like and experience to see. It wasn't ordered by doctor. It was called Miracle in Progress. It's a local place here in Vegas that shows you 3D 4D ultrasounds for your viewing to connect with baby. So it's not the doctor prescribed ultrasound. So that was super exciting to be able to check on her and hear her moving around in there, hear her heart rate and just her heartbeat, and just really stay connected. Because as of right now, I still have not had any fetal kicks, any fetal movement. I can't feel anything. I'm not really sure why. My placenta is posterior, so it's a good position. It's not blocking her. She's a good size. At the 20-week ultrasound that we just had, she's 11 ounces, or they estimated 11 ounces. So she's actually a little bit big for gestation, which my doctor said could be due to me gaining the weight faster. But either way, she's healthy. We're actually going for a repeat 20-week ultrasound to double check all her organs, because there was a few things that when they looked at the ultrasound, they weren't able to get a really good picture because of the position she was in. So we're going to redo that in like about 4 weeks to look at her heart and her organs and make sure everything is developing well. So no issues so far, and again, it was very emotional. The 20-week ultrasound, you get to see their body and them moving around in their face, and you just really connect because there's a real human, a real baby, a real soul in there growing. And day to day, you really just don't feel it. Like if you can't feel the movements, if you can't feel the baby in there, you just kind of just have a little belly, and you don't always feel as connected or as much that it's real until you see her and see the image and see her moving and her little hands and her little face. So I was super excited to see that again. And I'm happy, super happy she's healthy. She has all her extremities. She has all her fingers and her toes. And all of her organs look like they're developing really well. Her vitals looked really good. So yeah, it was very emotional. I definitely teared up and cried as soon as I saw her again. And Dave's kind of like looking over at me like, why are you crying? And I'm just like, because it's real. She's right there, It's going to be another 20 weeks before we meet her in real life. So that's a long way to go. I have, what is it, like 4 more months at least to go. So thank you guys for watching this video. I was just hoping to connect with you guys, explain my thoughts, my feelings, my symptoms, the surprises like the braxton hicks. I didn't even think that would happen this early at 20 weeks. I thought it would be closer to the end of pregnancy. But you know what? Every pregnancy is different. Every body changes a little bit differently. The hormones kind of come and go at different times. So I thought this would be helpful for you guys to know what to expect or what I've endured during my second trimester. Thank you.